everybody, and
Hi,
welcome
Michelle.
to
How are
tonight's your
you?
space presentation. We've got anxiety in children and youth, and we're thrilled to have Sue and Michelle with us for our last year space session of 2021. Um,
Oh,
and they're here to talk to you about anxiety, which we know lots of kids and families are feeling after a very long time with COVID. And hopefully, this will give you a little bit of support and information to get you through the next little bit. And I'm going to just hand things over to Sue and Michelle now.
that don't know who we are. My name is Sue Kelly, and I'm a behavior therapist with the Child and Youth Mental Health team with our community education service. Um, I've been at the hospital for a little over 20 years and been in my field of choice for a little over 40 years now. So hopefully I know a little bit about what our topic is tonight. Michelle, you want to introduce yourself?
Um, Yeah, I'm Michelle. I'm a child life specialist. I've been with McMaster for over 20 years, and we are here as facilitators, not as therapists. This is an educational workshop. So this information will help the general population, and hopefully you are able to take some tips home today. So everyone experiences symptoms of anxiety. However, it's when it gets in the way. That's when we're going to have some concerns. So if it's persistent, there's a combination of thoughts, emotions, the physical sensations like stomach aches, headaches, vomiting, and then behaviors. They get in the way of daily tasks. So school, friendships, getting on sports teams, going to sports teams, even ordering their own drink at the store. It can get in the way. So this is when we're going to start having a concern.
And one of the things that we want to address here and sort of bring up is that a lot of you are probably thinking about COVID times and, that this has been sort of made a lot worse, right? Anxiety has been made a lot worse, but we want you to think back to sort of before COVID. And if your child was experiencing sort of these anxiety symptoms pre-pandemic, okay? Because the pandemic has sort of raised new concerns and new anxieties, and if they were already in existence, it probably just heightened what was already in existence, okay? But if your child really had, like a sort of concern pre-pandemic, we want you to sort of think about how that was impacting some of those, typical things that they were participating in and whatnot pre-pandemic, right? Those social situations and school and those kinds of scenarios, okay? Because otherwise you'll be trying to sort of relate it to, how they were doing during the pandemic times, and that's kind of hard to relate to, okay? So the definition of anxiety is really that overestimation of a threat, and combine that with an underestimation of their ability to cope. And that is really the simplicity of the definition, and that actually creates that anxious response that we feel in our bodies, okay?
So then we have a reaction, which is the fight, flight, or freeze. So in caveman days, you were fighting a mountain lion. Now we are still in that survival mode. Most of our anxiety is not a physical threat, but we're still going to respond. So we're going to fight the mountain lion, are we going to run away, are we going to play dead? So these are how our children respond. And it's up to us to kind of understand their response and how we can respond to them and move forward. So we're fighting the anxiety together, and we're going to go through some more information on that.
So anxiety is a normal reaction to a real or perceived threat, to physical or emotional safety, right? And it's something that we have to have. It's an everyday emotion that we all experience, and we don't want to get rid of anxiety, because anxiety is that alarm bell that lets our children know and lets us know, lets all humans know that we need to maybe protect ourselves about potential threats, potential dangers, So it is that warning signal, right? So we can't get rid of anxiety. It's all about understanding anxiety, coping with anxiety, and knowing when anxiety is getting to that point of that it's interfering with how we live our life, and if it's stopping us from, sort of interacting with the world at large around us. And behavior and anxieties really change with age and developmental stages. So there are certain anxieties that are expected at certain ages, right? Such as like separation anxiety is expected in sort of under 5, that they don't want to be away from mom and dad. Okay.
So some normal fears really depends on the child and developmental level. But little children, I mean, we're looking at loud noises, strangers, being separated from parents, school-age children, things like, the dark, people that are wearing masks, certain things like that. And then school-age children, imaginary creatures are still an issue. And then, we've got, I mean, these are just the very, very small list, so many other issues. But in their teens, then we have things like injuries, natural death, disasters, social situations. And I would say school-age children start having these worries and fears as well. So there's some different components of anxiety. You get emotional, so overwhelmed, feeling frustrated, feeling scared, and that may be paired with some physical sensations like shaking or crying, my face getting hot. Then we've got the thoughts, I'm going to get hurt, my parents won't come back, I'll be embarrassed and I won't know how to handle it. And then we have behaviors. So some children will act out, some will shut down, others will run away, and really it just all feeds into each other. So we want to really understand where your child is coming from, and peel back the layers, and what is the helpful coping that we can give them for each of these components.
So we have a lot of thinking errors and distortions, and these really feed into the emotions, right? So they begin to start expecting that the worst is going to happen, and that they think that it's actually likely going to happen, right? So the predictability factor really goes up high. And they focus on the negative, right? It's very hard for them to see the positive side. They're very black and white thinkers. These are those always and never. They're not able to see any shades of gray. They're not able to, see when things go well at all. They very much overgeneralize. So when something goes wrong in one area, they think it's going to happen everywhere. And they're those mind readers, right? So they're able to just think that they're, sort of seeing the all-seeing mind, right? They're able to, sort of anticipate, well, this is for sure going to happen in this situation. And when I go to that party, or when I go out into the park, or when I go out into the playground, this is what's going to happen. Nobody's going to play with me. Nobody's going to talk to me. This is what's going to happen. So thoughts that may seem irrational to us, but they feel very real and logical to your child, because they also don't have that cognitive capacity that we have as adults, because their brains are under construction until age 25, in case you didn't know that. Sorry about that, breaking that news. But it's not just like flipping a switch either, right? I mean, this is a slow, gradual development of building that sort of cognitive development and cognitive muscle of being able to problem solve and think, rationally and sort things through. So we may be wanting them to sort of fluff it off, but it's very real for them.
And we mentioned emotions. So again, you can look up an emotion wheel to get more ideas, but really building up that emotional vocabulary and getting them to be able to label their emotions. They may feel overwhelmed, lonely, irritable, all at the same time, and all very intense. And then you've got physical symptoms that go along with that. Tense muscles, chest pain. Some children grind their teeth at night and are waking up with sore jaws. Some of them, feel nauseous. They will call you from school because they feel like they're going to throw up. Some children do throw up, but organically nothing's wrong with them. They don't have the flu. This is just their body saying something is up.
And I just want to mention too with the physical symptoms is that sometimes with children, well, even sometimes with adults, that we don't recognize those emotional and thinking signals and cues that we get. We don't recognize that we're having irrational thoughts, and we may not recognize that our emotions have gotten big. But by the time it has manifested into that upset stomach or the clenching or the crying, that's when we finally recognize, uh-oh, something's gotten too big and I can't manage it, right? So by the time we get those physical symptoms, that's when we start to realize my worries and fears are getting too big and I can't control it. And then though all of those things combined are pushing and sort of driving that behavioral reaction that we see. So the big one is really about avoidance. Yes, we see all of these other things where they're seeking reassurance and they may become withdrawn and we get those big reactions or they become restless and all of the other things, daydreaming, forgetful, hard for them to concentrate. But the biggest one is about avoidance. They want to disengage. As long as I don't have to participate in this particular activity, or I don't have to go to this particular place or go into that classroom or present or talk to somebody or order my food or talk to the cashier, I'm good. Life is wonderful. And I don't understand why you people have such a problem, right? I'm good. Life is wonderful as long as I can avoid it. So if they're disengaging and avoidance is becoming the pattern, that's the issue, right? Then we know that the anxiety is winning and we have that behavioral problem that anxiety is just going to spin out of control and it's just going to become an issue. And a lot of times this is where parents really struggle and they want to play into it and they're like, it's too much for me to deal with, right?
Exactly. So some other things to do is be mindful of thinking traps that might come up. You can maybe identify some of these for yourself. A lot of children that are anxious, I mean, there is a genetic component. Sometimes parents are anxious as well. So you may be able to relate to your child. And that's what makes it kind of hard because when you're feeling anxious, you feel bad for your child, you want to rescue. But the best thing is to work together against the anxiety and really understand it. So understanding your own anxiety, understanding, am I rescuing? Where is the child coming from? This will help as well. So these thinking traps will come up several times a day. And for some children, they have more of one than the other. It's being aware of it. And then where is the proof to say that this is true? So is this a thinking trap? Where's the proof? And what can we say to boss it back? So fortune telling, this is when we predict that things will turn out badly. I know I'll mess up. I'll never be able to manage my anxiety. We have some children that are those very rigid black and white thinkers. This is when we look at situations in terms of a good or bad, success or failure. Anything less than perfect is failure. So from these two, can you relate to either two? Do you think your children have these things going on? Mind reading is a big one. This trap is what happens when we believe that we know what others are thinking and we assume they are thinking the worst. Others think I'm stupid, she doesn't like me. And again, it's all perception and they're already anxious, so they are just assuming the worst of others. And then there's that filtering. This happens when we only pay attention to the bad things that happen, but ignore all the good things. So believing that you did a poor job on a presentation because someone looked bored or even a number of people, even though a number of people looked interested and you received several compliments, on how well you did. So this is an adult example, but I'm sure you can think of many examples for your kids where 10 good things happen, but they remember that one or two bad things, and that just kind of ruined that moment for them. And then there's catastrophizing. This is when we imagine the worst possible thing is about to happen, and we predict that we won't be able to cope. So I'll freak out and no one will help me. And the should statements. This is when you tell yourself you should or must or ought to feel and behave a certain way. So I should never feel anxious. I must control my feelings. So how many have you checked off so far? How many have you checked off for your children? And again, they can have many of these. Almost done, Sue. Overgeneralization.
Okay.
This is when we use words like always or never, and Sue has mentioned that already. This type of thinking is not helpful because sometimes we might make mistakes, but we don't always make mistakes. So if you say you always make mistakes, I'm never good at public speaking. Really? So you've never done a good job, you never listen, you never get picked. Let's talk about that. And the labeling, sometimes this happens externally, sometimes it happens internally. So it's that one word that we kind of use to describe ourselves. I'm stupid, I'm a loser. I think this is the last one. And then
To go.
overestimating danger. This is when we believe that something is unlikely to happen, is actually right around the corner. I will faint, I'll go crazy, I'm dying. So again, lots of different thinking traps. Your child probably has more than one that comes up during the day. How many of these come up for you? Where is the proof? And let's be aware of them and get in front of the issue instead of allowing these thoughts to kind of run our lives and our household. So Louise is going to put up a poll, and then if you can remember what they all mean, we'd love to know what comes up. So this is for you, not for your child.
Where do you get caught? Where are your traps? Hmm.
If anyone is having any trouble with the polling tool, you can just enter a message in the chat
For sure,
of a
for
couple of
sure.
your main ones.
Yeah, I'm seeing some in there. Yeah. Interesting.
We've got lots of predictors here of the
We
worst.
do. Yeah, between the fortune
Mhm.
telling and the mind reading, and we've got lots of should statements.
Mhm.
Shoulds, yes.
Mhm.
Parents get
Yeah.
caught up in that should.
Mhm. Yeah. So being
Yeah.
mindful of those things. A lot of people were not diagnosed when they were younger. It could be something that you go to your doctor for now. Whether you have a diagnosis or not, this is always something that you can reach out for help. And there's a lot of free um, programs like Bounce Back, for example, as you just need a doctor's referral for. But
Mind
I think
beacon.
it's
Mind beacon is another one. Yeah.
Mind Beacon. Yeah. So something to think about. And a lot of us didn't get support with this. We just kind of have been surviving instead of thriving. But being mindful of your own anxieties and the messages that you're giving your children. I do remember one time we had a parent come to a group, and they took the stairs and not the elevator because they were scared of the elevator. So you have to be mindful that if you're wanting your children to work on things, that we have to kind of be working on our own things as well, right? Children learn what they live. So it looks like Wellness Together is another program as well for adults to be able to access. And sometimes you just go to your family doctor because they can have social workers and clinicians that are attached to their team. Okay, so this is awesome. Let's take a look at what you think your children are going through. What are those thinking traps for your kids?
Wow. Okay. Interesting.
Okay.
So anxiety can be genetic as well. It is one of those disorders that is very strongly genetic, but it can also be emphasized by exposure to what children see sort of in their environment. So behaviors that they see, whether it be from other siblings in their family or parents or other caregivers, if there are those kinds of like avoidant behaviors that I was talking about, if those are sort of commonplace in the family, that it's like, well, no, we're not going to go here, or we're not going to go there, or we're not going to take the elevator. If those kinds of anxious and avoidant behaviors are commonplace, that can instill those anxious kinds of traits and behaviors. They may not necessarily get a diagnosis of having an anxiety disorder, but they may have anxious traits as a result of exposure to that. Yes, they can. They can very much follow in your footsteps, and it can ease into a disorder at some point, but that's for somebody else to make that diagnosis. But that exposure to that, and this is where we talk about it's so important for caregivers to recognize that if they are having those struggles for themselves, that they need to do their work and get some assistance and support, because it's really challenging to try and help a child deal with anxiety behaviors if a parent and a caregiver are not seeking their own support. And if they're still seeing those avoidant behaviors in yourselves or other caregivers, it's still reinforcing that the world is unsafe, right? Those situations are unsafe. And that becomes that perception that they develop. So it's just some insight for you to think about. So be
Yeah.
aware of your own emotional responses and reactions. And think
Mhm.
about, what is the feeling sometimes that comes up for you about your child that makes you feel uncomfortable when they're dealing with anxiety? Is it because it's too big? Is it the emotion itself? I don't know how to control it. I don't know how to deal with it. I don't know what to do. What do you maybe really believe is a more likely explanation for what is actually going on? Because there's usually other things that are going on underneath the surface of a behavior than just what we see. Do you think that other parents would feel the same way as you if they were presented with these kinds of behaviors? And most anxious kids can really read their parents like a book. So be cautious and aware of those body language and facial expressions that you share with your children on a daily basis, because they're very hypervigilant and very hypersensitive and reading your signals. And however, your child may not be accurately interpreting those expressions because they often negatively distort the meaning of our expressions and reactions. So what we may intend may not be, in fact, how they interpret. And the same goes for conversations and adult conversations that are being had in a household. An anxious child will often take snippets of adult conversations and they will sort of catastrophize and they will turn them into something that they are not. Sarcasm is a big trigger in a house because children do not understand sarcasm. So that is something that you really need to try to avoid. Same as names and tags and, sort of nicknames and things like that. A lot of times that can be real triggers. So sarcasm needs to really be avoided if you can at all costs because it's just something that's not understood.
So again, just going back to how is this affecting your child, your family, their school and education, and their involvement in the social world. If it's getting in the way, how much are we participating in that anxiety? How much can we empower a child, fight against the anxiety together, and create that plan? So this is how we create that plan. We've got coping strategies and skills for each thing. So for our physical sensations, what are some relaxation skills that will be helpful? Some children enjoy being active, doing some stretching, having a bath instead of a shower, playing with fidgets. What are those things that make them feel better? When it comes to emotions, being able to identify and express their emotions. A lot of times we're jumping in and fixing, we're saying, don't worry about it, but a child really just needs to feel heard. And sometimes we just need to give them a hug, ask them if they need space. Do you need a hug? Do you want to talk about it? Or do you need some silence? And we're not doing this in the moment. And them understanding what the emotions are, being able to label it, and then what do they need for that emotion to feel better. So Dr. Siegel talks about name it to tame it. So I can name my emotion. I'm feeling uncomfortable right now. What can I do to feel better? I'm going to count to 5. I'm going to look for 5 blue things in the room. Maybe do some deep breathing, those kinds of things. Thoughts, we're going to do that realistic thinking. I can't do it. I'm going to fail. Instead, we're going to say, where's the proof? You did well on your last math test. You're going to do great on this one. You have to try your best. What's the worst thing that happens if you don't do well? That kind of thing. And then the behavior, we're going to help them with some problem solving and decision making and expose them to those situations that they feel anxious instead of rescuing them and allowing them to avoid. We're not going to drop them into the deep end. We're going to take small steps to get them there. But we have to tolerate a little bit of our distress so we're not jumping into rescue, and also tolerate your child's distress. And again, this takes planning and lots of consistency, and we're not doing things all at once. We have to take it one step at a time and one day at a time.
So another strategy that we often teach in some of our courses is something called detective thinking. And detective thinking is about changing and shifting the perception of a problem. How big is it? What's happening? Rating it maybe on a scale of 1 to 10. Sometimes 1 to 10 is too big of a scale for younger children. So sometimes we might want to shrink that down to a smaller scale, maybe 1 to 5. But this is about looking for that evidence to support that negative distortion, right? So that negative thought. What is the evidence against it, right? And looking for a more realistic thought to challenge the negative thought. So the situation that's presented here is a very, very simple one, but it's to just sort of illustrate what we're talking about. So if I'm going to a park, for example, and I think that the dog is going to bite me, the feeling is that I'm feeling scared and I'm feeling anxious. The behavioral that's not listed here, but the behavioral sort of outcome to that might be that I'm running away, I'm crying, I'm screaming, and I need to get out of the park, right? Parents need to get me away. If I can shift that thought, right, into a more supporting thought, I'm looking at the dog and I'm like, the dog is really, really cute. There might be some other thoughts that go along with that. I'm with my parent. The dog is on a leash. They're on the other side of the park. I don't need to go near the dog. And automatically, that feeling of scared and feeling anxious goes down. I feel calmer, right? And I don't need to run away. I'm not screaming. I can still play in the park. I don't have to go and play where the dog is. I can go and play over in another area, and I'm fine. So it supports that positive thinking and that challenge rather than buying into the anxious thought and avoiding the situation. I stay in the situation, I challenge it, I reduce the intensity of the emotion, and I'm able to sort of find an alternative behavior that allows me to stay in the situation. So that's kind of what that detective thinking is about, is finding that evidence to support who says, where's the proof, and how do I kind of find an alternative helpful thought to allow me to sort of stay in this situation.
So here's an example of a scenario and how you can do this. And it's not easy for kids to open up and talk about these things because it brings up emotion. I want to avoid, and I avoid conversations with you because you eventually go away, but you still let me stay home, or we don't resolve the issue because you order my drink or my donut for me. So really, it's trying to sit down with your child to say, we're feeling a little stuck. I'm noticing this is happening. How can we move forward together? So sometimes doing these kinds of situations where you can use a show, you can use somebody else's example, you can make something up, or you can use these examples here to say, let's break this down. Let's look at the situation. What's the unhelpful thought? And what's the helpful thought? And, these are very simple things, but you can try other things, like a cat being caught up in a tree. What do you think he's thinking? Those types of things, especially when you've got some younger kids. So a group of kids is looking at her and laughing. So the unhelpful thought, you can ask your kids this, what do you think the unhelpful thought or the worry thought may be? Oh no, they're laughing at me. I must look stupid. They are probably, but instead, let's think they are probably laughing about something funny and I just walked by. I actually don't know that they were laughing at me. So there's other examples. And again, it's just going through that process of what's the unhelpful or worry thought? What is the worry bully in your head saying? And what can we say to boss it back? Where is the proof? What can we say instead? Okay.
Just wanted to address the question in the chat about when a child is avoiding sort of speaking about it, and that can be the challenge. Sometimes it's about taking a pause, and it may be about validating the emotional experience that they're having in the first place, to be able to just sort of meet them at that experience that they're having, so that they can feel heard and feel comfortable and confident that you are actually going to hear them. Because sometimes we meet them more in a reactive state, rather than one that's coming across like we're actually going to be validating and sort of listening to them, right? We can be a little bit more dismissive, like, that's okay, don't worry about it, you're going to be fine, which really is not validating how they're truly feeling. So when a child isn't opening up, we may need to sort of take our foot off the gas a little bit and really try to validate where they're at first in order to,
timing is very important as well. If your child's upset, you pick them up from school, what's going on? Tell me about it. And they're saying, I don't want to talk about it. And then we push and push and push. And timing is really important. We're agitated. We're heightened. So when is this conversation happening. It doesn't,
Yes,
doing it in the moment is not helpful for most children. Yeah.
it's not. So positive thinking. So again, you want to think about what does go well, right? So what does work with your children and how do you build on their strengths and foster that, right? So what goes well? Where are their strengths? How can I bring that to mind, not only for yourself, but for your child, right? So when do things go well? When do they have a positive experience? Do you not have interactions with friends any times, or has there ever been a fun time where you had a good time at school? Are there any subjects that you like? Like, do you like art class, or did you like going out for recess? Or like, is there anything? Look for those inconsistencies that can challenge. And again, this is part of that detective thinking, right? So you're looking for those inconsistencies in that black and white thinking. So increase those positive interactions with your child. Acknowledge their efforts, because it may not go well. It's very hard for them to sort of break these patterns that they've become entrenched in and say, I really noticed that you tried really hard. We'll do it again. How can I help? What can we do to sort of help break this pattern? Have your child use those positive affirmations. Have them come up with some of those positive phrases and helpful phrases. They're actually really very good at doing this if you give them the time and the space to help them develop these things. And use some distraction techniques. When we do this in class with our younger children that are 8 to 12-year-olds, they're actually really good at coming up with the distraction techniques, because we tell them that their brain can't think about two things at the same time. They can't think about their worries and fears and think about something fun to do at the same time. So whether it's a puzzle, whether it's a mind game, whether it's a song that they want to sing, whether it's, I Spy with My Little Eye, whatever it may be, it's something else that they can do with their thinking processes that takes them away and distracts them from their worries and fears, even if it is only for a few minutes. And a lot of times it can kind of shrink that worry and fear down. And that's the benefit of using a distraction technique.
So we were talking about emotions earlier. Let's expand that emotional vocabulary. What does that look like? Playing emotional charades, having an emotion of the day or the week, doing highs and lows at the dinner table so we can show them ourselves that good things can happen in our day, even though some unhelpful things or some bad things happened. So talking about those emotions, but again, not jumping into fix, just listening and expanding that vocabulary. Mad, sad, glad, and bad is good when you're two, but let's expand on that. And like I said earlier, being able to label it, name the emotion, and what can I do to tame it? So what are those things that make me feel calmer? This is a planning ahead thing, not something to do in the moment. And it should be part of the child's routine, and really read books, talk about emotions, label your emotions, label their emotions, normalize talking about all types of emotions without needing to jump in and fix and turn it into a 3-hour conversation. And some physical relaxation things that can help for the physical piece. Square breathing is great, and you can use a box to actually show them how to do that. Take a breath for 4, hold your breath for 4, breathe for 4, and then hold again. There's some really cool things on YouTube that can show you how to do this. You can look this up. And we've got a website here, Anxiety BC, that's got great resources, visualization and mindfulness skills, being in the moment, lots of books and YouTube videos and things like that. It's finding the best thing for your child, practicing and doing it when they're calm. So when worries and fears do start coming up, I've already tried this. We're not going to try doing it in the moment for the first time. Okay. Okay, just more examples.
Physical Yeah, it's just more. Just more. I was just expanding a little bit on somebody had asked about, what's a good emotional vocabulary for like a certain age, and it's really about working with your child
Mhm.
from where they're at. And then you need to do whatever you can to help build that and be creative, right? Be as creative as you can. Use flashcards, use movies, use TV shows, use charades, take pictures of your children's faces acting out different emotions. You can do whatever, have an emotion of the day to try and expand, picking a different emotion and talking about what that emotion is and, what happens when people feel that kind of emotion and what it means and what people need when they feel that emotion. You can start to expand that. But I mean, if they're 12 or 10 and they're still using basic words like mad, sad, glad, and bad to, sort of explain their general sense of emotion, then that's where you start. And then you gradually, start to increase it with some of the exposure to using some of these tools. And, for example, like the one that Michelle's going to explain right now, as another way to start to increase that vocabulary. You can't just jump in and say, okay, now use all these new words. It's about using tools to help them to find those words and what they mean and how they mean to them, how they can use them and
Yeah.
incorporate them
So
into their
this is
daily
one
life.
way that any child, even a young child, could fill in their body with different emotions. We can use different colors for different emotions. You can fill your bodies with feelings as well, like how does my body feel when I'm feeling anxious? Butterflies in my belly, my hands get sweaty, those types of things as well. So again, you can use body outlines for different things. It's using them on a regular basis so your child can communicate and also being mindful of how we react, because if you overreact, if we know you don't feel that way, what are you talking about? Then that child will probably end up saying, well, then I'm not going to explain this anymore. So just being mindful of those things as well. Okay.
So the worry ladder is about helping them with that exposure, to trying out new situations, which is all about dealing with the avoidance. So if they have a particular worry or fear, um, that they are dealing with, then they are going to decide on a goal. Okay, they're going to, come up with, something that they want to be able to do that they don't feel that they can do now. And then you're gradually going to set some goals and some steps of how they can begin to start to expose themselves to that situation, right? So, say for example, you have a child that, doesn't want to like order or talk to, um, I don't know, a cashier like at a fast food store, or maybe they're afraid of making a mistake. So we're going to go in, we're going to have them either order their own Timbits, or maybe we're going to take them in and we're going to go to McDonald's and we're going to ask for something that you would have ordered from A&W and have to deal with the fact that, well, no, I'm sorry, we're not at A&W and you can't get a root beer here. So having to make the mistake and feel it and then, leave is exposing themselves to that situation, feeling the pressure of that, and then having to deal with the anxiety of that situation. Having to go in and ask for the Timbit, order their Timbit, right, is exposing themselves to that situation. But you want to have a plan of, how do I deal with that? Do I do some deep breaths? Do I carry something with me? Do I have something in my pocket that I can hold, to help myself kind of get through that situation? This can work the same way for if you have a child that, say, is fearful of going down in the basement. They can start at the top of the stairs, and it's like, okay, we're going to take a few steps down, we're going to turn on a light, and we're just going to look down into the basement. Second step, maybe we're going to go all the way to the bottom of the stairs, but we're going to have somebody with me. Maybe the third step is going to be, well, I'm just going to go down into the basement and I'm going to have a parent stay sort of at the top of the stairs, but I'm going to be into the basement by myself and maybe wait for 10 or 15 minutes and then come back up. And then you keep expanding those steps gradually and gradually until they reach the goal that they wanted to have on their own. So it all depends on what the goal is that they want to be able to do on their own that they don't feel that they can do right now. So you have to have some buy-in from them. This cannot just be a goal that you want to make up. This has to be something that they want to be able to accomplish. And we strongly suggest that you start with smaller, more attainable goals so that your children kind of get used to the process of exposing themselves to these challenging situations and taking these small steps and getting used to having those successes and feeling of like, I've got this, I can do this, and this is good. This is a good feeling. I can overcome this. I can, do my breath work. I can, do some distraction techniques. I can try this out, and I've got this. I shift my thinking, and I can do this. And then they can start to tackle some of the bigger stuff.
So something we've talked about today is just taking care of yourself. You can't pour from an empty cup, especially if your anxiety is heightened, if you have anticipatory anxiety over needing to deal with this. I've got to drop off. Sunday nights are really hard because we have school the next day. Whatever the situation is, children learn what they live. And just like us, you learned through your parents, how to deal with emotion. Whether it was helpful or unhelpful, we may need to relearn those things, but you're giving your child a great gift to say, this is how I deal with my emotion, make it part of your routine. There's never enough time, so it's taking that time, penciling that time in for yourself, getting up a little bit earlier so you can have some downtime, that kind of thing. But what are those things that just turn the volume down a little bit, because you are going to be pushing your child outside of their comfort zone. When you're going to validate your child or try to understand where they're coming from, you can't fake it. If you're agitated, if you think, just go to school, what's the big deal? This isn't a big deal. Yesterday you were fine. It's really tough to validate and be patient with a child that you're just feeling frustrated. So that self-care is really important as well. And here are just some helpful numbers. Again, the resources will be sent to you later.
So just wondering, does anybody else have any other questions? We really do recommend that, like, this is just an introductory course. We do have a 3-session Parenting Your Anxious Child. So this really is a really good intro to that course, which we will be running in the new year. I think I can probably tell you when.
I'm pulling up the dates right now.
It starts January the 18th.
Yep, and I've got the link. I can post the link there so that you guys can get a head start on signing up for that one.
Yes, because we're doing that with you, Louise.
Yeah, and it is a great one. Okay, I'll pop that link in the chat. Okay, just checking, were there any of these questions, anything that
there
you
is one
needed to...
question. If a child is not sleeping through the night, usually it's anxiety that's keeping them up. So what are the thoughts going on? You'd be talking about that during the day. How do they fall asleep? What are they doing before they fall asleep? If they wake up, what can they do? What can we put these thoughts into a worry box that we're going to leave them for the night, and we can readdress them? Maybe they need a notepad by their bed because they're going to forget something. I have to remember to do something. But essentially, it's helping a child and trying to understand what are the thoughts. The majority of adults that don't sleep are because they're doing the same thing. So a 9-year-old doesn't have those skills. A 45-year-old sometimes isn't able to turn their brain off. So being mindful of that, what are they doing ahead of time? How much control do they have over it? What's the bedtime routine? What are they doing beforehand so they can wind down? And then you're working on what are the thoughts? What are we worried about? And doing that process. More things that we can work on if you come to parenting your anxious child for sure. But it's really getting underneath what are the thoughts and how can we move forward from there.
And if you have a child that is ready and you have the time as a parent to commit, and your child is between the ages of 8 and 12, we do have a no fear program. If they are more everyday worries and fears, no phobias or things like that that are not in a child's control, and you can find that on our hospital website, and I'm sure that our lovely hostess can post you that link as well to register for No Fear. And Michelle and I will follow up with you in the new year about that program if you want to be registered for that.
I am getting that link for you right now as well. I just want to make
And that is
sure.
a 6-week parent and child program that you guys participate together, and it's for children
Wonderful.
8 to 12. And it is a anxiety informed
And
CBT
thank you for sharing
program.
that app. So the Happy Child app, it's free and it helps with labeling emotions, and it's been helpful for one family, which is great. Dealing with teens and willingness to try strategies. Well, a teenager, I mean, you can't force anybody to do anything. So again, Sue mentioned validation. We have a workshop on validating your child and teen, and it's really understanding where they're coming from, insisting that somebody take care of themselves, insisting that they do it. That's not going to get you very far. It can be more about, I'm feeling stuck. I'm really worried about you. What would be helpful? I'm noticing that you don't feel comfortable talking to me, but I see that this is an issue. Would it be more helpful to talk to somebody else? How can we work on this together? Where we're taking the I out of it and we're really supporting them, and we're noticing that we're struggling. Sometimes when we're anxious, our perception is off as well. We think that the child is struggling more than they really are. So maybe they do want to spend more time on their own, but you're concerned about that. So are they doing okay? You know, how can we communicate in a different way? Because the way that we're doing things now isn't helping. I'm worried about you because you're sleeping the weekends away, or I'm noticing you're getting really irritable and angry all the time. So I'm just wondering what's going on with you. You have to start slow, and even to get them into a course or group therapy or something, I mean, you have to have their buy-in. So showing them that you have some compassion and you're trying to help them and moving forward with a plan together is really important. Working it out together is another course that could help with those.
Some additional supports and help, and those links will also be in the resources that Louise is providing for you to call, maybe contact Hamilton or whatever to reach out for some additional support, or talking to your family doctor, because there may be something else that's going on. So listen, every